Chairman, thank you so much for being here, Mr. Secretary. We're glad you're here. Let's stay on the measles vaccine just for a second. Let me catch my breath after that, all that. I'm an obstetrician. If a 25-year-old pregnant woman asked me if she should take the measles vaccine, the MMR, I would give her the answer, no, you shouldn't. But if she was 25 and trying to get pregnant, I would give her different advice. I've always valued the sanctity of the physician-patient relationship. I went to medical school for 4 years. I did 4 years of residency. I delivered thousands of babies. It's my job to give that recommendation. What's the role of the Secretary of HHS as far as recommendations of vaccine, and just discuss it a little bit further?
Well, the vaccine recommendations, Senator, are normally made through ACIP, which is the Advisory Committee of Immunization Practices, which is an outside consulting committee at CDC. There's another committee called VRBPAC, which is within FDA, that actually recommends whether the vaccines get licensed or not. And so that's where the recommendations come from. And you know what? Traditionally, they have not done evidence-based medicine. They only adopted evidence-based medicine about 12 years ago. And what we've said during our administration is we want to have safety studies prior to the licensure and recommendation of vaccines. Vaccines are the only medical product that is exempt from pre-licensing safety testing. So the only vaccine that has been tested in a full-blown placebo trial against an inert placebo was the COVID vaccine. The other 76 shots that children in this country receive between birth and 18 years old, none of them have been safety tested in pre-licensing studies against a placebo, which means we don't understand the risk profile for those products, and that's something that I intend to remedy.
Okay. You said earlier you couldn't talk about the reorganization, and maybe you cannot answer this question, but maybe you can at least confirm these facts for me or not. Isn't it true that under Joe Biden's White House, they added 20,000 employees to HHS? When you were nominated, there was 28 divisions with HHS, 100 communication offices, 40 IT departments, 9 HR units as well. Can you answer that question?
Yes, that's right. There are dozens of IT departments. There's 8 senior finance officials. There are 9 separate offices on women's health, 8 separate offices for minority health, 27 separate offices for HIV, 59 behavioral health programs, 40 opioid programs. What we're trying to do is consolidate, streamline, eliminate the redundancies, eliminate all those administrative costs for each one of those little departments, consolidate them, and make them make sense and make them accountable to the American people.
And I suppose all those IT systems communicate with each other. You all are on one IT
There's
system.
40, as you pointed out, there's 40 procurement departments with 4 separate computer systems that don't talk to each other. Yeah. So, you know, and as you pointed out, my department grew by 38% over the last 4 years. I would say that's great if Americans got healthier, but they didn't. They got worse. So what we're trying to do is go back to the pre-COVID levels and to start making the department function as it would if in a rational universe. And to bring in, modern AI and telemedicine and all the opportunities we have now, these new efficiencies and for medical delivery to the American people and for patient care. And we're not able to take advantage of any of them because there's so much chaos and disorganization in this department, and everybody who's gone up against it in the past has thrown their hands up and given up. Yeah. What we're saying is let's organize it in a way that I can quickly adopt and deploy all these opportunities we have to really deliver high-quality health care to the American people.
If I could, this was going to be a question, I'm just going to make a statement. All the research that we do on MAHA, on soil health, on nutrition, in my heart, that's research on cancer. It's research on Alzheimer's. at the end of the day as well. And we should be spending as much money at the front side of this as we are trying to cure the end of it. We're seeing epidemics of colorectal cancer, young age Alzheimer's, all these things. And I think the research at the front end is every bit as important at the hind end.
And you know, Senator Murphy made a good point. The NIH has made all these extraordinary breakthroughs, and particularly in treating cancer and, you know, reducing mortalities for colorectal cancer. But my question is, isn't it as important to find out why kids are getting colorectal cancer? When you and I were kids, there were 0 kids with colorectal cancer. It's epidemic now. So it's not really a badge for us when we say, oh, we can make it less lethal. Why don't we go figure out what's causing it and eliminate that exposure? With all of these, with Alzheimer's, with, you know, heart disease, there's something is making Americans very, very sick. And our response should not be just, okay, we'll develop a pharmaceutical fix for it or a medical fix. Let's figure out what it is and get rid of it so we can have healthy kids again.